Dr. Prayut Antun-Gravit, infectious disease doctor from Vejthani.Hospital. Your doctor has chosen to admit you to this hospital because you need high-quality medical care. The healthcare providers at Vejthani.Hospital will do everything they can to help you get well and to avoid complications. You should know that each year in the United States, patients get more than 1 million infections in the hospital while they have been treated for something else. Examples of infections that patients can get in the hospital include infections in bloodstream, surgical wound or urinary tract, as well as pneumonia. These infections can be serious and hard to treat, but there is one simple thing you and your family can do to help prevent these infections. Wash your hands and make sure that everyone who touched you, including your doctors, cleans their hands too. Patients and their loved ones who take an active role and become involved in their treatment may have better experience in the hospital than those who don't. In this following video, you will see how easy it is to be involved in your care and make sure everyone around you washes their hands. After watching this video, don't forget to make sure that everyone around you washes your hands to reduce the risk of infection.
My name is Vejthani.Hospital. I'm a nurse from Total Joint Replacement Center, Vejthani.Hospital. I'm here to tell you about the practice of proper hand hygiene you can do to help prevent infections. You and your loved one should wash your hands very often, especially after touching objects or surface in the hospital room, before eating or after using the restroom. It is important that healthcare providers, including nurse and doctor, either wash their hands with soap and water or use an alcohol-based hand sanitizer every time, both before and after they touch you. Healthcare providers know how to practice hand hygiene, but sometimes they forget. You and your loved ones can play a role by asking and reminding healthcare providers to wash their hands, especially while they are caring for you. You shouldn't feel embarrassed to ask everyone, including doctors and nurses, to wash their hands to prevent you from getting an infection.
Hi, Mom.
Oh dear, I know you washed your hand a little while ago, but do you mind to wash them again?
Sure, Mom.
Thank you.
It's important to remember that healthcare providers aren't the only who need to practice hand hygiene. Patients and visitors should also wash their hands very often, especially after touching the face in the patient rooms, before eating, after using the restroom, before and after patient contact. Our patient daughter could have also used alcohol-based hand sanitizer to clean her hands. Both of these practices can help to prevent the spread of germs. Let's take a look in another patient room.
Hello, how is he today?
About the same, I think.
Well, I'm going to examine him briefly. I hope that you will become involved in your medical care by reminding everyone, especially your healthcare providers, to wash their hands. You can get an infection in the hospital while you're being treated for something else. You can help prevent infection by asking your doctors, nurses, and visitors to wash their hands. Doctors and nurses encourage you to do so. Thank you for your attention, and I wish you a speedy and uneventful recovery.